COVID booster is an extra dose of either the Moderna, Pfizer, or J&J vaccine to boost or increase your immunity as it wanes over time. We know these vaccines were terrific when they first came out. You will recall that they were 95% effective in preventing new cases of COVID. But as time has gone by, and after 6 to 8 months, the efficacy of those vaccines has waned and is now down to somewhere between 55 and 65%. So we've lost a significant benefit of that vaccine. The good news is a booster or extra dose dramatically improves your immunity back up to the 90%, 95% range. And that's why it's essential for people to get their boosters now, so you're fully protected. We as healthcare workers are at higher risk than the general public. We're around people. Yes, we screen our people. Yes, we wear protective clothing and protective gear, but we're still at higher risk because we're constantly interacting with sick people. And many of these people might have COVID without us even knowing it. It's essential that we be immune because we're dealing with patients, and patients put us at higher risk for getting infected. We need to be immune to protect these patients, to protect ourselves and our family. And the best way to stay immune is to get a booster now. Everyone in the United States is now eligible to receive a booster, as long as you're 6 months out from your initial series of vaccines, your last dose of either the Moderna or the Pfizer vaccine. You can get a booster as little as 2 months out from the J&J vaccine. People are becoming further and further out from those initial doses. And once you're 6 months out, you need a booster. Yes, there certainly are, and the side effect profile is very similar to what was seen with the first 2 vaccines. Fever in about 4 or 5% of people, a sore arm in up to 30 or 40% of people, malaise, not feeling well in a significant percent of people, some mild, some severe for 24 to 48 hours. Lymphadenopathy under the arm, particularly after the Moderna vaccine. Headache, joint ache, these are all commonly seen after these vaccines. Occasionally late rashes are seen. Most of these side effects go away within 48 hours. In a small percentage of people, they can last up to 5 days. Mixing and matching is now permitted. In general, we encourage people to stay with the brand that they previously got. The one exception may be for those who've gotten J&J, they might benefit by changing to Moderna. But you can mix and match if you prefer, or you can stay with the same brand if you want. In most of the messenger RNA studies, you are 20 times less likely to get a breakthrough after you've had a booster. The booster takes about 12 days to be fully effective. We don't know how long that booster is going to last. It may not be the last booster you get. More likely than not, you'll be getting boosters for the rest of your life or for the coming years, but they are very effective, at least in the short term. We encourage you to do that. Flu is in the community. It just entered. Flu is going to be here. We don't know how severe this flu season will be, but there are worries that it'll be a lot more severe than last year. So please get a flu vaccine to protect yourself, your family, your loved ones. Remember, in an average year, between 25 and 45,000 people die of influenza each year.